We really didn't start graduate medical education until after Hurricane Katrina. And as a response by the LSU School of Medicine and other programs down in New Orleans, they asked us to participate within medical education. And quickly we realized that we're a great venue for education for future physicians within the state, and we really enjoy having residents from across the country come to Our Lady of the Lake.
One of the things I definitely come here and seeing that it's a new program is that they got this kind of fire to it, that they want you to succeed. They want you to succeed because they're new, they want to prove that they're going to be a good program, so they're doing everything for you to help you succeed.
There's people from California, from Georgia, not even from the US, and it's a great program. You'll fit in, you'll find your own little niche in this area.
If you are a person that enjoys working directly with people, that enjoys one-on-one teaching with a mentor, that enjoys doing procedures and getting feedback directly from an attending instead of from a fellow, or a massive chain of command, that this program is exactly what you're looking for.
I have been out to football games with residents before, and it's just something that we try to emphasize at this program and have from day one, that we recognize that we are training up colleagues.
One of the things that we do is we play basketball with some of the faculty, and it's always fun because they may best you in the medical environment, but you tend to, or at least I tend to, be able to take advantage of their age and skills on the basketball court.
If you want to come to a program where everyone is friendly and welcoming, and you want to be in a program where you have input, and if you have that kind of pioneer spirit where you want to, change things or be a part of something new, then I think that this is a great place for you.
I think definitely what stands out about Our Lady of the Lake Children's Hospital and my training here is the faculty. Without fail, they are amazing teachers, and I feel very privileged to work with them, not just because of their enthusiasm for teaching, but really their passion for their patients. They're good physicians because they care about their patients and because they're willing to teach you how to also take care of your patients in the future.
It is a strategic decision to look at how do we make our patient care and our clinical excellence shine. And you do that by teaching the next generation of physicians.
We talk about how many beds we have here, what our patient numbers are, but we have a collaborative agreement with Women's Hospital. Women's Hospital is a fabulous women and infants hospital where the deliveries in this region, the bulk of those deliveries are done. Women's pretty much stays in the top 10 to 20 nationally in numbers of babies delivered every year. And that's where our residents do their neonatal intensive care work, and they also do their term newborn work. And then they rotate with all of our subspecialists for consults over there.
They are really focused on teaching us the right way, and then the way different specialties practice, we go through, we change each month in order to be 1 month with the cardiologists, and then 1 month with the pulmonologists, GI, and then we see how a specialist thinks.
The physician group itself, as it integrates with our pediatric residency, gives our residents the exposure with the private world, how to handle patients, how to handle insurance, how to handle different types of coverages within that type of a setting. And so you get a much more well-rounded experience with regards to the general practice of pediatrics.
Many of the residents who have come through, they were a little bit anxious, apprehensive about their rotation in the intensive care unit. After completing the rotation, they start feeling more confident in the care that is delivered.
There has never been a time that I have felt scared to ask an attending a question. I've never felt belittled. They've never said, "Why don't you know that?" Things like this. They constantly teach while at the same time building up.
It's a wonderful place to learn how to be a physician because there's great respect, great professionalism, and the community sees its physicians in a very respectful manner. And I think maybe that's lost in some areas of the country. It's definitely not lost here.
When you graduate from medical school, you want to learn how to become a doctor. And here, you learn how to become a doctor very quickly and very efficiently because of how much time they spent with you one-on-one.
The population is in need. They are in need for someone who wants to come and put the child first. And that's really what we're looking for. So if that's the candidate, you know, that if that's what they feel like they needed to be doing with their lives, then this would be a great place for them and a great fit.